Everyone, thanks, Stacey. It's my honor to introduce the folks who are presenting today. And so in order of the presentations, Jonathan Park, who's an applications analyst team lead at CHOA, will be presenting on REDCap, and then Jordan Marchak and Rebecca Williamson Lewis, who are both in the AFLAC Cancer and Blood Disorders Center, will be taking us through a research project that they've been helping lead as an example for how to handle data, especially in these bigger projects. And then lastly, Jeremy Kupsco, who's a research informationist at the Woodruff Health Sciences Center Library at Emory, will be talking to us about the new rules for data sharing. So with that, I will let our panelists share their screen and get started. And we look forward to this awesome session.
You ready to go, Jonathan?
Yeah, absolutely. Sorry. Let me share my screen and we'll get started. Awesome. So just kicking things off. Hi, my name is Jonathan Park. I'm the applications analyst and team lead for the REDCap program here at Children's Healthcare of Atlanta. So we work with a lot of research teams. That's kind of our primary focus in the REDCap team. So we build all sorts of research studies here at Children's, ranging from exploratory pilots and chart review type work to clinical trials and multi-site studies, so coordinating between many different collaboration sites. So we've handle kind of the gamut of research here at Children's. And so today I just want to talk about some of the features that are a part of REDCap that we use and utilize to collect clean data, to clean data during the research process. And afterwards, if you've collected all of your data and are working to clean it up and get it ready for analysis. So some of the things I'm going to walk through include your data validation settings and some of the accompanying action tags you can use within REDCap, which is one of the main features to kind of really customize and hone in on your data collection. The data resolution workflow or otherwise the double data entry setup, so you can utilize that workflow in REDCap, as well as some of the data quality rules. So getting started, I'm sure some of you who have used REDCap before are totally familiar with this, but whenever you're adding fields to your project within REDCap, you have all sorts of data validation options. So here I've just highlighted one of the various date options. You can have date time setting, various other validation options. You have numerical options. So if you want just an integer, a float, you can specify the decimal values you'd like. But that's only the beginning, right? Because once you've set your validation type, you may want to restrict that even more, right? So in this example, I've just put today as the maximum value. So we're not going to want anybody to enter a future date into this particular field. And in addition to that, this was actually added not too long ago, I want to say within like the last 2 years, is this additional action tag. It's called the force min max action tag. And what that helps to do is further restrict the validation or enforce that rather. So if somebody were to put in a date past today, in the past, you would get a warning option, but you could basically click away from that and continue on in some situations. So really to force that and not allow somebody to even submit that data with that potential error, you can always add that to your workflow, and that way it will kind of keep prompting somebody to correct that error and enter in a value that you want in that range. So that's one simple option, and the way I'm going to walk through this is kind of like from beginning to end, right? So these are some of the steps that you would take at the beginning of your project when you're setting it up to try and get the cleanest data initially, right? So again, in combination with actually setting your field validation types, you may want to add that action tag, especially with text values, right? Where you're having people type things in as opposed to some of the other options like the radio buttons or a drop-down list. So in addition, I mentioned the double data entry option for REDCap. This is something that can be enabled for a project or not at all. It's totally optional. A lot of our projects tend to collect data directly from from research participants, or in our case, oftentimes caregivers. So in that case, this is more so for an internal workflow. So if you have data entry personnel that are entering data off of physical forms, chart view data, you can have a double data entry setup where you have one or multiple staff members enter in data under first entry, second entry, and then you have the review process. So to set this up under the user access settings, you can create roles. So in this example, I'm just setting up like the first entry role, and then you can basically copy that for person number 2. You can see that down here. So once you select each role or create a group to add multiple people to, once you select that person 1 for first entry, that'll go away, and then you can set up second entry and the reviewer role. And so how this works is every time you're creating a record, let's, in this example, I've just created our very first record in the project, so record 1, whoever is doing first entry, you'll see here the --1 gets appended to the record ID. And so, so once that person completes their first entry and the second person completes their entry, you'll see these 2 entries now both under the record 1 kind of header. Then so the --1, --2 signify each of your entries. And then we have what's called the data comparison tool. This tool is actually accessible even if you're not doing double data entry, and kind of the baseline usage for this is to review potential duplicate records. So if you ever have a situation where you think 2 records might be duplicates, or at least have a lot of duplicate data, you can just use this to compare 2 different records in your project. But in the double data entry workflow, what this is going to do is let you compare entries for one particular record. So in this case, I've pulled up the 2 entries here, and you can see for this one question, there's a discrepancy between the 2 entries. So in this first entry, we have a 5 entered for the value of this field, and then a 2 for the second entry. And so by clicking in the appropriate box to resolve that, you can update that value and kind of harmonize those 2 entry records. And this is just what it looks like if everything went smoothly, there were no discrepancies found. And so you can finally merge those records into kind of like the final official record. In addition, you have the data resolution workflow. So this is great for record keeping and for, let's say, Part 11 FDA funded studies that maybe have a very robust record documentation requirements, or if you just want to have a little bit more notation when it comes to updating and resolving any data discrepancies. So under the additional customizations option, a lot of times by default, you have the field comment log, which is great if you want to add notes and keep track of any ad hoc items for a particular field or data form. But the data resolution workflow kind of allows you a middle ground between doing the whole double data entry workflow and having a log of what sorts of changes are made to your data. So within your project, if you enable the data resolution workflow, you'll have some other options. They're called what's essentially queries. I know that could be a little bit of a craziness. We have database folks here, but so when you open a query for the data resolution workflow, what this is going to do is allow you to assign it to people that have respond access in your project to then review any data issues within your project for a record. So by opening those queries, you can have somebody else review that field and respond to them. And the very last thing I want to do really quickly is pull up the data quality menu. So if I can swap over really quickly. Okay. So in the REDCap UI, you also have the data quality menu over in the left-hand side. And by default, REDCap does a good job of giving you a lot of these default options to review your data. So you can see here a few initial options regarding blank or missing data. And so by executing some of these rules, you can see it'll give you a quick look initially at if any of those issues exist. So right now we're looking good in my pretty empty, admittedly empty test project. So we have no missing values for anything or especially required fields. But if we look down here, we have some of these options for validation errors. So as I mentioned before, in the past, without that force min max action tag, you could end up with some data that may be outside of your specified range. And so you can use these rules to review that and fix those errors. Another crucial one that I see a lot has to do with incorrect values for calculated fields. So if you set up calculated fields in your project, and especially if they refer to dates involving today, that can often be an issue if you ever need to kind of recalculate those, or if you're switching that over. Anytime you change or edit a calculated field, the formula, however you've written up that calculated field, you'll need to come back here to recalculate those values. So this is another helpful tool. But in general, you can also add kind of custom rules. So if you have a particular need, let's say you've noticed a specific error or a recurring issue in your project, you can always generate a new data quality rule and check that from time to time by entering your own rule logic. Let's say you want to check for specific combination of this field being entered in a certain way, or subsequent fields missing values if you have branching logic set up. So this is another great tool, maybe as you're collecting data throughout your project, or at the end, when you really want to focus on cleaning your data for analysis, running these sorts of custom rules can help you pinpoint some of your any existing data issues. So I know we went through that pretty quickly, but I think the my general summary for REDCap is that you have a lot of combination of tools that you can use from beginning to end, right? When you're setting up your project, and I'm sure others today will be talking a lot about this. There's a lot of things you want to do up front to try and collect the cleanest data you can possible. But throughout the process, you have a lot of other tools to resolve these issues and maybe curve them as you're going so that you can hone in on these and clean up any recurring issues you might have. So that's all I have now.
Thanks, Jonathan. Appreciate it. We'll move to the next session.
Hey, I'm Jordan Gilleland Marchak, and today I'll be presenting alongside Rebecca Williamson Lewis about a project that we've been working on that certainly has benefited from a lot of thought and Rebecca's expertise with REDCap and data hygiene. Next slide. So the project that we're going to use to walk you through an example for data hygiene is improving support for survivors engaged in transition, or ISSET. This is an administrative supplement to Winship's P30 that's being led by myself and Dr. Karen Effinger. And so the goal was to reduce inequities in care for adult age survivors by understanding and improving healthcare transition practices. We had two aims for this study. The first sought to evaluate organizational programming needs to help survivors continue their risk-based care after they leave pediatric cancer centers. And our second aim was to identify organizational barriers and facilitators to implementing the 6 core elements of transition within the context of survivor cancer care delivery. Next. So once survivors reach age 21 in our clinic, the AFLAC Cancer Survivor Program, they must transfer their survivorship care out into the adult world. And so many transition to the Young Adult Survivorship Clinic at Emory, or they transfer out into the community to see primary care providers, college health, or internal medicine. And so through this project, we are hoping to inform organizational changes to improve healthcare transition supports for survivors, both survivors who stay at our center and those who receive care in the community across our catchment area. Next. And so to achieve that aim 1, we had several data needs that we had to think about before we opened our project. The first was that we needed to identify our cohort of patients who had aged out of our center between 2016 and 2020. Then we needed to figure out how we were going to recontact these young adults to determine the patterns of successful healthcare transition, as we defined it as an initial appointment with an adult survivor care provider within 18 months post-discharge. But this was a big group of people, about 450 that we needed to re-engage with. And then lastly, our last need was we were going to collect some patient-reported outcomes from them. We wanted to solicit feedback from young adults and caregivers using the GOT Transition Healthcare Transition Feedback Survey. Next. And so these needs resulted in some corresponding challenges that we really had to think through prior to opening our project. The first being we were engaging in remote recruitment of patients who were no longer engaged in our care. And we opened this project during COVID when many of our staff were still working remotely. And so one of the issues we ran into was, since patients had transitioned as far back as 2016, we had outdated contact information or we had missing contact information. We were also seeking patient-reported dyadic data from both young adults and their caregivers. And so we needed a way to reach both the young adult and their caregiver and recruit each separately, but yet at the same time. And we had to think about building options within REDCap to track and manage issues related to research with young adults. So some young adults may not want their parents contacted, and other young adults may not be their own legal guardian due to cognitive impairments, and thus they wouldn't be able to consent or engage in research without guardian approval. And so a lot of attention to data hygiene was necessary on the front end so that when we completed it, we would be able to accurately identify who had been reached for recruitment and did they respond to us. And we also wanted to build systems into the project to gather contact information from either the YA or the parent that we weren't able to reach to try to get a hold of that other part of the dyad. Next. And so today, Rebecca and I are going to quickly run through our practical methods that we used to identify our cohort, track their recruitment, collect patient-reported outcome data, and manage data abstraction within REDCap.
Yes, so good data hygiene truly starts with how you set up your data collection tools. And here at CHOA, we use REDCap for survey-based research. And as Jonathan was talking about, REDCap has a lot of options and flexibility to design your project that fits your research objectives. But these structural decisions impact data collection interfaces for participants and study coordinators, and also the underlying data structure for reporting and data analysis. So I'm going to walk through a couple of the options we considered when trying to address the study's data collection challenges of remote dyadic survey collection. So first, we considered the classic data collection of one row per patient. This would require us to build two separate surveys that included all of the variables from both the caregiver and young adult surveys, because we were not sure who would be completing the survey first. And to do this, the variable names would have to be unique between the versions. But we wanted to ensure that all the variable names were the same, regardless of the order that they were completed. So next, we considered the repeating forms, where we would build one survey that could be completed many times. But we wanted to ensure our student coordinators were able to quickly see which version had been completed, and we knew we only needed 2 surveys per patient. So finally, we decided to use a longitudinal data collection with defined events because we were okay with having multiple rows per patient. So this is what we built. There were forms for patient information, tracking, consent, young adult and caregiver surveys and incentives, and medical record abstraction. And these survey forms were then assigned to the events of parent and patient information and tracking, survey 1, survey 2, and medical record abstraction. And you can see the study dashboard that clearly shows which participants completed the survey and which version they completed. So as Jordan said, the population we were trying to recruit for this study were patients who had aged out of our system. So we needed to generate a list of all the patients and their contact information for remote recruitment. So this is where it's important to know the sources of data available to you. So in AFLAC, we have the oncology registry as well as a sickle cell clinical database. Additionally, survivors seen in our clinic are scheduled with specific appointment types that are available in Epic's reporting workbench. So if we didn't have these resources, we would have, or if we were looking for a population with some different eligibility criteria, we would have submitted a research data request for the health informatics core. When you're submitting your data research request, ensure you have all of your documentation, including IRB approval and any necessary DUAs before submitting your requests. And also remember that any data you receive back might be messy and might still require manual abstraction or interpretation. So that's something to balance in thinking about, should I do a data request or should I just manually go ahead and do this? But once we had our list identified, I used the data import feature of REDCap to import the eligible participants into our project. When doing a data import, you have to ensure that your variable names, coding, and any text validation matches what's built already in REDCap. Otherwise, you'll receive a nice error message telling you exactly what to fix. So this is our contact tracking form. We used embedded fields to make our form more user-friendly for student coordinators. It includes contact information imported from Epic, any additional emails or phone numbers collected during phone conversations, and piped contact information collected on the first survey completed. One aside is that if you choose to build your contact information alongside your surveys, ensure your protocol acknowledges what data you're collecting and linking. And the contact tracking form also had detailed recruitment tracking for each of the surveys, including date of first survey sent, documentation of phone calls, and any additional recruitment efforts outside of REDCap. It also pipes Survey 1 completion information, and the coordinators complete that Survey 1 outcome to identify when the survey was completed or if full recruitment was reached. And Jordan's going to talk a little bit more about our recruitment methods.
Yeah, so we took everything that Rebecca built for us in REDCap and then employed a multi-method strategy for remote recruitment. And so for participants that we had identified that had email addresses on record, we sent an initial recruitment email containing a web link to an online consent document and a survey battery. And that email was sent as an invitation through the REDCap. And then we did alternating follow-up recruitment emails and phone calls over a 6-week period. And one thing that I wanted to make sure to mention was that, as you can see in week 3, we sent an email using Emory Outlook because that was the only way that we would be able to trace bounce backs. If all of your emails are sent via REDCap survey invitations, sometimes you're not able to know if an email was delivered or if that address was still active. And then after 9 weeks, if we had no response from potential participants, a letter was sent to their last known mailing address. And we used a QR code printed onto the letter that was specific to that participant so that they could scan it, provide updated contact information, and go ahead and participate in the study if they so chose. Next. And so to help track this 9-week process, we developed reports in REDCap so that each of our coordinators would know where their assigned potential participants were in the recruitment workflow. Because as we mentioned before, this was over 400 patients that we were trying to re-engage. So we needed to divide up the efforts between different coordinators, and also different things needed to happen sort of each week. And then we also developed several study management reports to help myself and Karen monitor study progress, generate metrics required for IRB, and study progress reports. And these reports are also going to come in handy and allow us to quantify our recruitment and retention metrics once our study closes to accrual so that we're able to easily generate our consort diagrams when we write this up for publication.
So a couple of thoughts about our dyadic survey collection. We didn't necessarily know if the email address we had on file was the young adult or caregiver. So based on our response in the consent survey, the participant was automatically directed to the parent or young adult survey using REDCap's survey queue feature. So for this study, the surveys were available in both English and Spanish, and we tried to use REDCap's multi-language feature, which allows one variable to collect responses in both languages, but we learned that the language is saved for all events. So when we wanted the young adult and caregiver to be able to select their preferred language, we ended up building separate English and Spanish variables. And then finally, to try to prevent missing responses, we required all questions to have responses, but we wanted to be able to allow the participants to skip questions they preferred to. So we also included a decline to answer response option. So I wanted to give a couple of thoughts on variable coding and include an example of what not to do to yourself. So REDCap has a very user-friendly interface to build fields, but it doesn't necessarily mean it's simple. So if you know who's going to be analyzing your data, it might be good to check to see if they have any preferences in their coding. But in general, you should stick to accepted conventions of short, informative variable names and using 0 for your reference group. And you should also try to limit free text fields. Be sure to use validation on dates, emails, zips, and other fields to ensure consistency. And if a question has several known response options, make it a drop-down or multi-select with the known options and include a text box for the others. That way you only have to clean kind of the others. And one caveat is if you're doing contact tracking in REDCap is ensure you include a big text box for all of your recruitment notes to be captured. And then if a study captures multiple time points or reporters, ensure your variable names and coding are consistent. Use suffixes in the variable name to denote differences, but ensure the coding is the same so that a 2 on your pre-test means the same thing as a 2 on your post-test. And finally, it's likely that your survey will include validated measures. So REDCap has a library available of common measures that you can import into your project. Be sure to double check the coding and functionality of any of these measures that you import, and then be sure to cite them appropriately in your manuscript. And if you're building one from scratch, use variable names and coding that align with the measure and its scoring manual. So I'm going to use this as an example of what not to do briefly. So in a different study, we use the adolescent sleep hygiene scale, and the paper version is seen on the left of your screen. And so you can see that the questions are numbered consecutively, and they have 6 Likert responses anchored with never and always. And on the left is the scoring manual, and you can see that there are subscales, and the scoring has 6 points for never, 5 points for once in a while, and so forth. And throughout this example, we're going to focus on question 3 here. That says, after 6 in the evening, I have drinks with caffeine. And this question is part of the physiological factor. So this is a glimpse of the data I received. You can see that the variable names reflect the scale and are numbered consecutively. And here's question 3 that I automatically assume refers to the question of interest with the coding from the manual. But then I noticed there's a 0 as an option. So then I take a closer look at the code book, and the first thing I notice is that it was coded opposite of the scoring manual, with never being 0 instead of 6. So all of the questions would need to be recoded. Next, I find question 3. And here it says the question is, during the hour before bed, I drink more than 4 glasses of water. But that is actually question 12 from the measure. So I scan through the code book and I find question 3, only to discover that that is variable 1. So it's very confusing and a big headache. So before I can score the subscales, I have to recode every question to match the scoring manual, and I have to clearly map each variable to their question. So this was, I wanted to make sure I was scoring everything correctly, and you can see a screenshot of, all my handwritten notes of what to rescore and what variable was actually which question to do this. So don't do this to yourself. Make sure any coding and question numbering align with your scale from the initial build. And one thing another lesson learned I wanted to talk about briefly was that REDCap has missing data codes feature that you can enable when you're building your project that allows variables to be identified as missing versus blank. But to get these codes out, you have to select them to display in reports, and missing codes come out as separate variables for multi-select questions and can be problematic in statistical software if the missing code is text, but the variable is supposed to be numeric. So after implementing this in a project, I think in the future, I'll hard code missing options into data abstraction forms, or use abstraction manuals to tell coordinators what exactly to enter for missing data. So some take-home points is that good data hygiene starts with how you build your data collection tools. REDCap has a lot of features. Be thoughtful on what you implement in your project. Try to involve your statistician or epidemiologist from the outset. A good analyst can restructure the data, but really hates recoding everything. And there's no one best way. There's a best way for your projects and the needs of your research question. I'm going to turn it back to Jordan.
We just wanted to do some thank yous and acknowledgement for the rest of our study team. Karen Effinger, my co-PI for this supplement, as well as our amazing team of student research assistants, to Dana Ray and the Winship Cancer Institute for their support, and NCI for the funding. And that's it.
Thank you both. That was awesome. I like the real world examples. So, we'll move to our last speaker. Jeremy, if you want to share your screen.
Okay, hi everyone. Good afternoon. I'm Jeremy Kupsco, a research informationist from the Health Sciences Library. And today I'll be talking about an introduction to the NIH's new data management and sharing policy. So this went into effect back in January 25th, and it covers all research funded and conducted in part or in whole from the NIH that generates scientific data. And I'll give their definition for scientific data the next slide. And the requirements of the data management and sharing policy is that one, you submit a data management and sharing plan with your application that prospectively plans both the data management and sharing of the data that you'll create with your award. And the second part is that you comply with your data management and sharing plan that's approved by the NIH Institute or Center or Office. So again, it applies to all research funded in part or in whole that generates scientific data. And the NIH defines scientific data as the record, recorded factual material commonly accepted in the scientific community as of sufficient quality to validate and replicate research findings, regardless of whether or not it's actually published in a journal or a scholarly publication. Some potential examples of scientific data. Of course, US, the researcher probably have the best idea of what the scientific data is, but some examples might include if you're doing single RNA sequencing, that the single RNA sequencing results would be your data, electrophysical physiological recordings and fMRI images in a study, step activity from a wearable device in a study of cardiovascular health. So those will all be some examples of what the scientific data would be. But probably more importantly, examples of what's not scientific data. So your laboratory notebooks, preliminary analyses, completed case report forms, your drafts of scientific papers, plans for future research, peer reviews, communications with colleagues, or any physical object that you may create, such as laboratory specimens, would not be scientific data. So what grants does it apply to? What awards does it apply to? So it applies to the R awards, the research projects, certain career development awards, such as the K awards, the small business, SBIR, STTR awards, and research center awards. It does not apply to training awards, Ts, the fellowships, Fs, construction grants, conference grants, resources, or research-related infrastructure programs. So again, the requirements are that with your grant application, in the excuse me, in the budget justification section, you'll submit a data management and sharing plan outlining how scientific data and any accompanying metadata will be managed and shared, taking into account any potential restrictions or limitations. This will not be scored. This will only be reviewed programmatically by the NIH staff during the just-in-time period. So if you have issues with your data management and sharing plan, it will not be part of your score again. You'll have to correct it just in time with your program officer to get the correct data management and sharing plan. So you have to share and manage the data according to your plan. Data should be shared no later than the publication or the end of the award if it's unpublished. So the NIH, I've been told that the NIH considers data to be preliminary if it's not published in a preprint, a conference proceeding, such as a paper or a poster, a book chapter, or again, a publication. So you may want to, if you have data, you may not want to share by the time the end of your award. You may want to make choices to keep it in the preliminary sort of category, or you can apply for a no-cost extension. Other relevant requirements and expectations, such as repository policies, journal policies, should be followed for minimum timeframes. The data should be shared. And again, all scientific data should be managed, but not all of it has to be shared due to legal, ethical, and technical factors. Some of those reasons why it cannot be shared would be informed consent will not permit or limits the scope of sharing of the data. Privacy concerns for the participants, that you believe the privacy might be compromised if the data is shared. If there's explicit federal, state, or tribal law or regulations that prohibit disclosure, or restrictions imposed by existing or anticipated agreements with other parties. Non-justifiable limits for reasons for not sharing your data. So your data are considered too small, you don't think the data will be widely used, or you don't think the data has a suitable repository. So those are not justifiable reasons to not share your data. So compliance and enforcement of the award. So this will become a term and condition of your award. Failure to comply with the terms and conditions may result in enforcement actions, including additional special terms, conditions, or termination of the award. The compliance will be assessed annually as part of the RPPR. So in the future, there'll be additional questions added to the RPPR to help determine how well you're complying with your data management and sharing plan. And again, when should you share your data? So as soon as possible. So again, at the time of the publication in a peer-reviewed journal, or at the end of the award, if it meets the requirements of not being preliminary. And just a sort of aside, the NIH considers the publication date the first date the article is published. This is a little bit different than what they consider for the public access policy, where you have to share your journal articles. For that one, the physical publication date is the one of record. For this one, it's the e-publication date would be the date of record if that's before the physical publication date. You are allowed to add request costs. So reasonable costs that you're allowed to add into your budget request are the costs for curating data and developing supporting documentation, preserving, sharing, and data through repositories, and local data management considerations, such as maybe as IT will be storing your data. Not considered data sharing costs would be infrastructure costs, typically included in indirect costs, and the costs associated with routine conduct of research, such as the cost to purchase a data set. Just a consideration with the costs is that you have to use these costs during the time of the award. So if you're paying IT or a repository to manage to hold your data, that those costs have to be upfront. So obviously you can't pay the storage costs to a repository after the award ends. So or IT to store your data after the award ends. So you have to figure all that costs out upfront and pay those upfront. And the library, IT and research compliance have come up with sort of an Emory-specific site with information. So you can see the link here, and I'll put it in the chat in just a minute. But what we did was try to go through and think of data sharing scenarios that may occur, such as you're using an NIH or domain-specific repository. If you have a large data set that doesn't like to be moved, or sensitive data use agreements, you maybe want to try and patent the data, or you're going to use a generalist repository. So we try to come up with data use scenarios and come up with specific sort of template language that can be used for those scenarios. So I encourage you to look through the page and check those scenarios out. And we also came up with the repository decision tree to help you determine what data repository you should use to share your data. And so in the future, we'll update that website. So far, we're sort of in a holding period that the first round of data or sort of R01s back in February have gone through, but they've not gone through the just in time. So the researchers haven't received any feedback yet on how well they wrote their data plans. So once we start hearing feedback from the NIH, we can update the website specifically to include feedback we might hear in the community or from specific researchers on what the NIH liked or didn't like in their data management and sharing plans. We'll also review data management plans. You can do that through the website. There's a link to the DMP tool. And the DMP tool is a tool that has templates to the NIH and other funders data management and sharing plans. And in this case, it has NIH-specific templated language and also community templated language from the DMP tool. And there's also, if you go to the DMP tool, there's also an option to submit it for review. And it'll be reviewed by myself and 4 other individuals with data experience here at Emory. So with that, I'm done. And for other contacts, you can contact Jen Doty, Research Data Librarian at Woodruff Library, myself, or the sort of our data planning listserv, which the address is here for any questions. So thank you.
Thanks, Jeremy. So we'll go ahead and open it up for questions. Please go ahead and either type your question into the chat if you'd like, or raise your hand or turn your video on, and you can ask a question verbally. While we're getting started, there's one question, Jeremy, for you about the timing of when this will start. So the example is if somebody submitted their application in 2022, but the just-in-time happens in 2023, will they be required to submit a data management plan in their just-in-time?
No, so that it goes to all new submissions and competing proposals January 25th or later. So so that was the initial submission dates for those. So it's now currently in effect for anything in 2023 after that January 25th date, but anything that's submitted before then, your next, I guess, renewal will be when it will take effect, competing renewal.
And do you know, related to that question, will anything change in like the RPPR, like the annual reporting for these kinds of applications that are kind of bridging?
Yeah, that's a good question. I know eventually they've talked about adding questions. I know it's one thing they'll be looking at to make sure you're complying with it is sort of a digital object identifier if you submit it to a repository or the NIH's own or NCBI's persistent identifiers in their databases. So, and the newer RPPRs look for questions like those to be added to check for compliance.
Okay, thanks. While we're waiting for other questions, I did have another quick question for you, Jeremy. I know you mentioned that there were certain K awards that the data management applied to. For this audience. They might be interested if you could give more information or let them know where to go.
Yes. So if you go to the research data website that I put in the chat, we should have a listing of, there should be a link to the NIH's FAQs. And there's a definite FAQ on which grants numbers fall under the policy. So I would recommend that you go to that FAQ and you can see the complete listing of the award numbers that fall in that.
Okay, wonderful.
Policy. Yep.
Thank you. I'll just keep asking my own questions then if no one else has any questions right now. I did, this is kind of more broadly to the speakers, partly because I've had this happen. So say you've built your database, you've started collecting data and you realize that you like made a big mistake in terms of like how you've asked a question or how you've set up the data entry part of it. You know, what are your options at that point, you know, once something's live?
Well, I guess part of it is how far along are you in your abstraction, like if you're at the end, or and how big your list is. But you can always add options, like that's pretty easy to do, and add forms, like adding in things is relatively easy to do. You can't really change, like if you have, you know, response option 1, 2, 3, and it's coded 1, 2, 3, you can't say, oh, I want to make 3 now 4 and 5. You could add, you know, 5 and then use some of the data quality checks that Jonathan was describing to like kind of find all your 3s that you would then want to like recode. But yeah, you can add in forms. That's relatively easy. If you decide that like, you know, like this question I want to ask now in like 3 separate ways, you can add in those new questions. And then there's an action tag that Jonathan was talking about earlier where you can hide the old question. So the data is still there when you export it. But then like your abstractors aren't seeing the old questions, they're only seeing your new questions. So you don't lose kind of like what you had before. And I'm sure Jonathan.
I wonder if any statisticians are on and are cringing at that possibility, and if they want to chime in on how to consult with your statistician ahead of time to minimize damage of missing data. I thought I saw someone on. Maybe not. Okay, well, statisticians, please do put in the chat if you have any words of advice or cautionary notes with that. But go ahead, Jonathan, if you want to add anything to that.
Oh, sorry, I might have been muted. Those were great. I would add, there's another kind of alternative to all this, utilizing the calc text action tag. So by default, you know, calculations in REDCap really prefer to work with dates or numerical values. So if you've coded something not using numerical values, let's say you have a Likert scale, some people will code, again, sorry to statisticians, but some people will code them using like the letter values, right? So if you have like agree, strongly agree, disagree, all those, you know. So you can always use the calc action tag, calc text action tag to recode some of those values. And what that does is it acts like a calculated field. So it's not meant for active data entry or survey entry. What it can do is take the value from an existing field and basically help you recode it. So there's many uses for this. It's a super helpful action tag to use. We use it all the time for generating like an email address. So let's say you have a list of people, but you don't want to have duplicate work, like, oh, enter in your email address. If you know the corresponding values to a person and their email address, you can code that in so that once they select their name from a list, it will automatically load their email address into that field. But again, for recoding data, you can always use that action tag to set up a secondary field. So let's say you have a form that involves reverse scoring for some items. That's another possible use. Of course, you can always code that into your larger calculated value. Let's say you have like summary value calculations to generate like a raw score total. You can always add that chunk of calculation into there as well. But that's another method to really preserve, again, the data that you have, the existing data, but use it in combination with like hiding that field, as was mentioned, so that you're preserving everything, but getting that clean output that you want, that you could then just use in your reports and your data extracts.
Thanks. And I think generally it sounds like consulting with the experts and getting input as you're making any changes after the fact is probably wise, so that you don't mess something up if you've already started collecting data. So there was a question about finding specific data repositories. And I know, Jeremy, you put a link.
Yeah, I put a link to the NIH's recommended repositories in the chat. The first thing I would do is check your institute. Some of them have a requirement that you submit data produced to their own repository. So I would check the list or check the institute and see if they have their own repository. If not, probably the next option would be to check your field if there's known repositories in your field. Then third would be go to look at a generalist repository. And Emory does have its own generalist repository called Emory's Dataverse, that there's information on the research data website about how to submit to that.
Thanks. I guess with that, since we're right on the 1 o'clock dot, we'll go ahead and wrap up the session. Again, thank you to our wonderful speakers. I think this was a really cool session. I learned things too, so really appreciate everyone's time and attention. Please take the survey that's in the chat if you get a chance. And with that, we'll wrap things up. Okay, bye, everyone.